Some, what is it, like some low back pains?
Yes.
Right? And what kind of troubles you been having with that so far?
So it keeps me up at night and I can't seem to get a comfortable position. Lifting is hard, bending up and down, like doing exercising, like I can only do things that are less of high impact, so no high impact. Yoga is a little bit better, but still even some of those stretches, I crunch when I turn and do hip movements, when I do twists. And it's just generally like it's stiff and it takes me a long time till like midday before I feel like I'm loose and able to move around, and it's a constant, dull, aching, stiff pain in the lower back.
Fill us in, what happened to that thumb?
So I was learning self-defense classes and I was punching the bag without having any wraps. So I felt like I hit this and maybe misaligned it. And so now when I feel it every day, because when I pick up a pan and I'm cooking or doing things with the kids, I have weakness in this motion here. And so it feels just off and I don't have a tight grip. And like holding my mouth open, it locks in place. And I have a little click.
Gotcha.
And then it hurts after a while if it's open for so long. It doesn't need to be open that wide either. But so yeah, we had that for a long time.
All right, and then down to the next list. Fill us in on what's going on with that bunion you got.
This is painful. Like even if I'm wearing sneakers or even a low heel.
And since you're a nurse, you definitely understand the deal with inflammation.
Right.
So one of the byproducts of inflammation is heat. I can't put my hand over here. See, this is warm, and cool. So, but problem is my hand is 80 millimeters across, whereas this, see that's 2 millimeters. So this is far more accurate and sensitive. It will identify, there's something abnormal and warmer at this particular level. And then we're going down the spine. We got something here, a minor little blip there. Looks like a little chronic nerve. And then next spot, and there's a big one because I see one big swelling over here, right over here. Chronic nerve. Upon visualization, and one of the signs of inflammation is swelling and edema. So we see already a big patch over here. Now we check for abnormal motion. How's that fella right there?
That's a little tender on that right side.
Yeah, it's stuck. That's not moving whatsoever. Sinks right there. So you have some pitting edema right here at this level. And then we hear it. Hear that?
Yeah.
Sounds different, right? So it's all that swelling and edema. You got this swelling around this side right here. So we checked for abnormal motion. Right there. You see you got a little tight muscles on your, on your right side. So you got swelling on the left. So we check at this particular level. Yeah, that's stuck. That ain't moving too well. You see this one over here? You took a little vacation, went backwards. So that fifth lumbar, all intents and purposes, what it did was this. Normal, but yours went backwards and tilted this way as well. So as we see over here, as a result, see, it's just foramen or this tunnel, that nerve got to exit out of there, and yet it collapsed like this. So just to reiterate once more again, okay, the bones don't really pinch nerves. It's all that swelling. That's what we found out over here, that big the pool of fluid over there. That's what causes the nerves to pinch off. All right. So whatever that nerve's connected to will not work as well as it should, which may help explain why I got that bunion and the knee issues going on as well. So we're gonna address this one first. Okay. Next component is that 6 dorsal and that 5th cervical over here with that DJD. Yeah, we're gonna correct that one as well. Little more. Little more. Here it is. Let it all go. A little more. Just let it go. That was $1 million shot right there.
Wow.
Come on up. How do you like that? Neck adjustment.
That was good. I feel free. A lot looser. Like I have more movement, less stiffness, especially right here.
Nice. Ready for the next stuff?
Yeah.
Let's do it. How's that?
Oh, that's much better. I had weakness here before, but now I can.
See, it was that fifth cervical was not allowing enough nerve function to that wrist over there.
Okay. Like I didn't have a proper punch too. Like the form of my fist was wrong, and this went all the way down. And
Why?
not wrapped.
Rookie mistakes.
Yes. There it is.
There it is. Now we're
I
talking.
felt that one.
Yeah, we got the lunate too. Yeah. Now move it around. See, I like it.
That's so much better. That's what I needed.
That's right. Is that a whirl?
Yep. Yep. I did it. I got the strength back in that.
Nice. So in order to correct this bunion over here, right, we need to restore the medial arch. The talus is the keystone, but in order for the talus to stay put, the only thing holding it in place, there's no muscle attachment, which is interesting enough. Every other bone in your foot has a muscle attachment to your leg. Talus is the only one that doesn't have it. It's only by ligaments. Therefore, if there's a problem at that fifth lumbar, which you did, okay, there's no way it has enough nerve function going on to this talus to keep this arch intact. So therefore, that's why this thing, it went out, right? So that's why we have to correct your low back first, get the nerve function here first, and then we're gonna correct this talus over here. Restore this arch, and then we're gonna check everything else along the way of this arch. So talus, first thing we're gonna fix. A little more. There it is. Just let it drop. There's the magic. There it is. And then now we work the bunion itself. Oh, there's a piece. Feel that little click in there?
Yeah.
It's gonna be a little tough set. Good. Walk around.
Yeah, that feels better. It always felt like it was always bending out that way.
Uh-huh. How's it now?
It feels much better.
Great.
Yeah. You don't know that you're living with all this pain until you really get the relief from it. Like it just becomes normal.
A little bit here. Just open, close. Open, close. There it is. Felt that fella clunked in?
Yeah.
Okay, walk around.
Oh. That's a lot better. Smoother. It doesn't feel like it's locked open. That's much better. I want to hug him. I want to hug him.
Okay.
That's so much better, doctor. Thank you.
Oh, you're very welcome.
Oh my gosh.
All right.
Yep.
Go enjoy. You're all set.
Thank you. Well, my jaw has been not giving me any problems at all. It's been perfect. It's well aligned and it's feeling great. My hand is not 100%, but it's a lot better than it has been before, and I've been feeling a lot stronger. I have a better grip, and I can make a better fist.
Let's try that.
Yeah. So much better. It's been so much better this
So what's
whole
left
entire
over?
week. So my back is still crunchy, and my bunion, it looks and feels better, but still not 100%.
Okay, so what's left over of the bunion?
I haven't worn high heel shoes, but I still just, it feels a little bit out of place, like a bunion does.
We'll work on that.
And then
What's the story with the wrist? You say it's not 100%. What are you
right here, it's just still a little bit weak, but I've been working on it. I have like the stretch ball, so I've been strengthening it a little bit more, but it's still a lot better than it was when we first came in.
Excellent. Let's get to work.
Okay.
Right there, a little more. There it is. A little more. Twist. There we go. Oh, right there. There's a sweet spot. Nice. Now give it a whirl.
Oh, that's a full gallon.
Yeah. Oh, that's much better. It's so. Yeah. I'm gaining it back. That's good.
Nice.
Yeah.
Yeah, this is a full whole time.
Right.
Like 5.5 pounds right here
Yeah.
compared to what it was last time.
Right.
All right.
So much better.
Bunion time. Okay, let go. There's one.
Let it go. Oh, there's a piece. There's a piece.
Good.
Just let it go. There we go. Walk around.
Awesome. Oh, great.
So,
Yep.
cool set. How do you like it?
Love it.
Awesome.
Yeah, that foot feels so much better. Like even when I was wearing thong sandals,
Mm-hmm.
like it would feel like it was so much further out than it was. It just never felt aligned and always like coming out. And so I would just, at night, I would like watch TV and always like be pushing it back in just for like therapy.
Mhm.
But I don't feel like I have to do that anymore. So for last
Great.
week I haven't had to do that.
Hey, that's excellent.
Thank you, doctor.
Hey, not a problem. You're welcome.